Hello, there you go. Well, good evening and welcome to our next community conversation about mental health. And this evening we're going to talk about navigating mental health and substance use systems, And you all should have a little program. And I just want to thank, before we get started, all the panelists for being here and talking about different resources. And we're going to kick it off tonight with Jenny Schill. She's going to demonstrate the website 211. And the purpose of this tonight's session is to help people understand what are the resources that are available in our community to help deal with both mental health and substance use systems. And I was handed some notes. This is being broadcast live on Facebook tonight. And all of our sessions are on our website. You can access them through our YouTube channel. And I've been told that the first one we had, which was on suicide, we've had 221 views on that already. Education and resources, 41 views. Resiliency, 139 views. And substance use disorders, 151. So we're getting people to watch it. So this one I think will be a fantastic one to have access to and understand. And then we've had the webpage has almost 1,000 hits as well too. So we would love to see this overflowing with people, but we see this as also being an opportunity to really record and document this information so people can go ahead and access it when they need to. And we do have one more. This was going to be the last one, but as those who may have want to come, we had a pretty bad storm forecast last month. So we went ahead and made a last minute decision. As luck would have it, we canceled it, and you're welcome. No storm came through. But it will be in June. And let's see. Forgot the date. I'll get that. What's that?
June 6th. No, she did June 6th.
It's on the bottom down here. It was cut off. June 6th. Thank you. Anyway, this one, I keep touting it as being going to be fantastic. It's going to be on civility and conversations, and it's going to be an interactive session. And we have Scott Redeker, who is the director of the Bob and Billy Ray Center on the Drake campus, that will be talking about ways to practically encourage and be engaged in civil conversations. So with that, we'll turn it over to Jenny. And then when she is done, she has to leave before our time is over. So we're going to have some questions and answers for Jenny, and then we'll move into the ARCH scenario presentation and the panels. So Jenny, thank you.
All right. Good evening, everyone. So I'm working with United Way right now on promoting 211 in the county and trying to get as many organizations added to the database as possible so that we can have a full resource representation of Story County. So who here is familiar with 211? Okay, so about half. I was not aware of 211, so I'm pretty excited to talk about it because it is a great resource and very accessible for anyone to use. So hopefully it can help as many people in the county as possible. So this is the homepage. And let's start with a little bit of what 211 is. So These are kind of the categories that 211 services. You can see right here the underlined areas, but 211 is a free comprehensive information referral system linking anyone in the state of Iowa to health and human service programs, community services, disaster services, and governmental programs. And it's a one-stop shop. And there are kind of 4 options of how you can access 211. The first is you can text your zip code to 898-211. And I have business cards and flyers back there with information. So you can text 211, you can call 211, and that's just like calling 911, but you'll be connected to a person that will then connect you to the resources. You can also download the 211 app. There's an app, or you can use this website. So let's go to resources. So if you're going to use the website, you'll come to this page and you're going to start out. I forget to do this every time, but you have to enter your zip code first. Otherwise, it will kick you back right here. So start with that. And let's, for tonight's example, go to mental health. So these are all the different categories. So under mental health, you have all of these options. So let's say someone was in crisis. So they could click this, or someone is working with someone in crisis. And these are all of the organizations in Story County or within 50 miles. And you can change that up at the top there. Within 50 miles that offer services in this area. So we have YSS, Central Iowa Community Services, Irely Ball, all of these. And then let's just click on Irely Ball. And then on this page, it should have all contact information. It should have locations. If you click directions, it'll show you how to get there. It also has information on the side, extra information you might need, how you qualify, are there fees, intake process, documents you might need. All of that should be listed there also. So on the flip side, if you are an agency and you would like to be listed, we would like to get as many as we can so that we have a full representation. If you're an agency, you can come over here to the agency side. And the first thing you're going to want to do is look at the inclusion-exclusion policy, because not everyone qualifies for this. So you're going to want to click there and read through that. If you do qualify and you aren't listed, you would click the new agency. And then down here, there are a few steps to take. And then you would click the application. And this is an online form. It will be sent straight to United Way of Central Iowa in Des Moines to the database manager. Fill out as much as you know. If you don't know everything, that's fine. She will then get in contact with you and get more information if she needs it, or she can find it on the web. And then this will also include any services that you have. So you can list as many services as you want, and that will be also added to the database. If you are an existing agency that you know is already listed and you would like to update your information, add a service, a new service, you just go over here to the updating my agency. And then if you click here, you'll be connected directly to, her name is Amanda in Des Moines, her contact information. You can email her or submit a form to update your listing in the database. So I will open it up to questions if you have any. Yes, Jean?
If I live in Illinois, can I call 211?
Well, yes, it's countrywide. And actually, so the state of Iowa is split up into 3. Let me show you this. It's split up into 3 kind of, does that fit it? That's good. 3, there's one up in the corner. But we do actually cross over, some of our Iowa agencies cross over into the bordering states. So yes, but yes, it is nationwide. Yes.
So we have many immigrants now that don't speak English, and they have some concerns with documentation. How does someone maybe who has challenges with some of those things navigate the system?
So all of our material is also in Spanish. And if they call the database, they should have someone that can speak their language or get connected to someone that can speak their language.
And what about documentation? Are there limitations for some of the services to those who have documentation?
I'm not sure about that. I mean, you can search through.
Not through 211, but the services they might get would be
Okay.
Yep, 211 is for
anybody.
anybody. Yep.
Thank you.
Other questions? Yes.
Do you have any information about what the utilization has been?
Yes. We do a monthly or a quarterly tracking and we report to the county. But you can go to this tab and do a full search on who's using it, what the top services are, what the top agencies are, referrals. All of that is located here. I won't go into that tonight, but other questions?
So he went through some scenarios. Let's say you have a parent that's concerned about their student, what they would.
Could you repeat the question, please?
Sure. The question is, if you have, that's good. First of all, if you're a parent and you have a student who is struggling, what would you do? What would take us through that? Just kind of show some different, options. Or a friend, for example.
Struggling with school or with?
Yeah. Fill in the blank. At school with minor misdemeanor, whatever. What's mental health, certainly.
So let's say struggling maybe with reading. Let's say that. And it doesn't have to necessarily be the person looking for the service, searching this and getting connected with the agencies. Anybody can do this and refer people on. So you could click, oops, yeah. See, zip code every time. So once let's just use LSI here. As a parent or someone that you could call any of these numbers. You could email. This would be the main email that the LSI wanted listed for their listing. You can go directly to their website. I probably would prefer calling 211 and talking to a person. These are highly trained people to talk someone through this process and find out what the actual need is and get them connected with the best resource that there is available to them. So I would probably talk to that person, what's actually happening, and then they will refer you on to the best agency that they think would be helpful to you. Does that answer your question?
Just trying to help people just get an idea that this is really kind of a giant directory is what it is.
Yes.
To help people know where things are at, because I know in previous sessions we've talked about this. People have asked questions and how do I find this contact person, or how do I find help in these particular areas?
Yep. And it is overwhelming to know what is available to you in this community. So this should be helpful to at least get you narrowed down. And that's also why I would probably call the database 211, because they are a person that knows this, works with this every day, and they're going to be able to direct you better.
And what if people can't afford some of the services? Is there financial assistance for using this?
To qualify for this, you have to offer either at minimum sliding fee to be accepted as an agency for this. So yes. Yeah.
Certain hours when it's
I believe it's 24/7.
I'd ask the hours of the phone for people that are answering the 211 line.
Yep, 24 hours. Other questions?
How are you getting the word out?
So we are trying to get marketing materials out to the county. I am driving them around, but any agency can go to the website and click on 211 materials. And there are some that you can print off yourself. You can download the PDF file, or you can, like, if you can't print it, you can click right here and email and be connected to United Way of Central Iowa, and you can order marketing materials. But we have business cards, we have the cowboy card flyers, and we also have the big poster, and also this 3-number poster that we're putting up at gas stations all over the county, because that covers a lot with that one poster. So, and feel free to grab stuff in the back. You can also email me at storycounty211@gmail, and I can get you any of those materials if you'd like some.
So Jenny, I do have a question. So 211 has been around for quite a while and has been in the making for a number of years. So this is really the most robust that I've seen the resource and being available in different methods, whether it's the app or calling or the website. So can you go back to the resource list and just kind of show again the different categories? Because I
Sure.
think it's really important for people to see that it's very inclusive of, clothing, financial assistance, the food, physical types of health, income, employment, all of those types of things. It's just so much more robust. And that's good to see for people to be able to utilize what's out there. I think a lot of times people don't know what's out there until they really need it. And so this is a great place to go.
Yep. Yeah.
I think that would be a quicker read if you put your alphabetical order linearly. Okay. Yes, I realize they're in alphabetical order, which is wonderful, but that's harder to see across than it would be if you had 3 columns in alphabetical order.
I'll pass that on.
Thank you.
Other questions? All right. Thank you.
Thanks, Jenny. All right, we're going to transition now into some scenarios, and that's going to be Lindsay's going to take it. And actually, before we get started, let's just go down we have a very distinguished panel tonight. Thank you all for coming. And maybe just introduce yourself so people get familiar with who you are, and then we'll let Lindsay go ahead and start. And I think you're going to ask them to help you participate in the scenario. So go ahead, doctor.
I'm Dr. Sherry Pflugrad. I'm an ER physician at Mary Greeley. Been there for 18 years.
Susan Moore, social worker on behavioral health at Mary Greeley. I've worked at Mary Greeley for 8.5 years.
Mary Swartz, I'm a judicial mental health advocate. I serve several counties, but tonight I'm here on behalf of Story County.
Julie Saxton, mental health advocate, Ames Police Department. I've been in my role for 8.5 years.
Bill Dean, I'm with Unity Point Health, Irely Ball. I'm the executive director of clinical programs. I've been in my current chair for 96 days, but my first 22-year career was in child welfare, juvenile justice, probation, and mental health, behavioral health. So.
I'm Kathy Johnson. I'm a service coordinator with CICS in the Story County office here, and I've been doing this way too long to even think about.
What is CICS?
We're going to get to that.
So I'm Nikki Sprecher. I'm also a service coordinator with CICS here in Story County, and I have been here in Story County for 10 years.
I think the question was, is what does CICS stand for? That's all.
Do you want me to say that?
Yeah, just what the title is. Yeah.
Central Iowa Community Services.
Thank you.
It's on your phone.
Yeah.
Brittany Rice. I am the outpatient addiction supervisor at Community and Family Resources. I've been with CFR for almost 6 years.
Carrie Williams. I'm the mental health clinical director at CFR. I've been in the business for over 30 years. Don't count my age, folks. I've been at CFR for over 5.
My name is Spencer Blake. I'm the residential substance use counselor at Youth and Shelter Services for our youth recovery house here in Ames. And I've been with YSS for 3 years on Sunday.
Thank you. All right. Lindsay?
Yeah, I'm gonna get this going. Yeah, let's see. Yes. Okay, there we go. Okay.
Okay, so I'm Lindsay Smith. I'm a social worker and part of the new program here in Ames called ARCH, which stands for Alternative Response for Community Health. It's a 2-person team, which consists of a mental health professional, such as a social worker, and then an EMT paramedic from Mary Greeley. And we respond to assigned 911 calls in the city of Ames and just kind of help navigate kind of what it says up there is appropriate resolutions to different crises that are happening. Maybe when an ambulance or a police isn't necessarily appropriate or needed, we can go in there and provide some support and call them in later if we need it. But it's also to help kind of not use those resources if they're not necessary and leave them open to the people that do need them. So we go and provide assistance, and I'll kind of walk through a call, or not a call, but a process on how we kind of do that. Whoops. There we go. So we don't have an actual number for ARCH. We are strictly through 911. So a person would call the non-emergent number or 911, and they would run through their kind of their protocol of sifting through what support they need, if it's police, if it's ambulance or fire. And once they kind of determine that it's appropriate for ARCH, or maybe with ARCH can go with EMS. I'll keep talking if you want to figure that out. So they dispatch us, and a couple of things that we go to are welfare checks, mental health, anything mental health related, homelessness, suicidal. Go
ahead, keep talking.
Okay, let me go this way. Oh, I think okay, we're good. I won't touch it. So whereas like an ambulance would go for chest pain or falls or trauma, or like police going for violent crimes or traffic and law violations, ARCH can be kind of dispatched for those different criteria. And then once we get there, it's not, we respond non-emergent. So we make contact with the person, whether that's by phone or in person, however that can be, wherever they're at, whether that's at home or in the community. The paramedic EMT can do any basic medical assessments on scene. And then we kind of just go from there in terms of identifying what's needed, what the problem is, and what we can do, whether that's connecting to a resource, just being a listening ear, helping them get to a safe place if that's the hospital or if that's back home. And then we can provide some follow-up. We don't really have that as part of our program, but if part of the plan is, hey, like, we're going to get you home today, we'll give you a call tomorrow and see how you're doing, we can do that kind of thing. So basic, we have two scenarios that, is it okay if I go right into them? Okay. And so one scenario is one with a call that led to us or to them going to the emergency room, and another call that did not. So this first scenario is an individual that we got called out to that was actually with her therapist, and she was suicidal and agreed to go to the ER for further evaluation. So part of the whole thing also which was that she was unable to commit to safety, but so like she wasn't able to say, hey, I'm not having suicidal thoughts. I can go home. I can be safe. I'm not going to self-harm. She wanted to go to the ER and get evaluated, but she also had some past trauma that led her to not want to go to the ER. She was kind of fearful for what that process looked like in the ER. Would they put her in a locked room? Are they going to take all her stuff? And just, she was just kind of fearful for what that looked like and what that process was. So it was helpful for Arch to be able to kind of walk through that beforehand and then go to the ER and actually talk with the nurse or the doctor that was going to talk with her and kind of advocate for, hey, this is kind of some past trauma stuff that's gone on, and just kind of reduce the triggers or hopefully not make it a more traumatic event for her. So once she gets the ER, apparently, I'll pass it to you.
So when a patient, does that work? Still no? There you go. So when a patient would arrive either by ambulance, Arch, or come in the front door by a private vehicle, if they are there for anything mental crisis, health related, treated just like any other medical patient, but we do have government kind of sanctioned safety things that we have to start with. Everybody, when they come to the ER, it's a government required question. We ask, are you safe at home? Do you feel safe in your surroundings? Are you having thoughts of harming yourself? So if you're there for abdominal pain, an ankle fracture, or suicidal, you're going to get asked those questions. And that's in order to hopefully catch people who maybe are there for an unrelated complaint, but have underlying mental health that we need to address urgently. So all the same questions get asked to everyone when they first arrive. If you do present with an acute mental health complaint, we do kind of separate out and put mental health patients in a room that would be different than if you were there for a motor vehicle crash or a chest pain, and place them in safe rooms. So there's nothing in there where you can harm yourself or harm anyone else taking care of you. And then you would have a evaluation by an RN, and then eventually by a physician or a nurse practitioner to evaluate for mental and both physical evaluation to make sure there's nothing else physically going on that would need addressed. You would get screening medical laboratory studies and a full evaluation, and then determination from that point whether you need to be hospitalized or we can get appropriate outpatient resources that we don't have an acute crisis that requires stabilization within the hospital. If you would be discharged, we would help with discharge planning. We have social workers and crisis nurses that can help get the appropriate counseling services referred, outpatient psychiatry, primary care, any of those resources you would need. And then if inpatient, if we have an appropriate bed available at Mary Greeley, you would be hospitalized there. If our unit is full, or you're under the age of 18, we do not hospitalize anyone under the age of 18 at Mary Greeley. We don't have an adolescent unit. Then you would be transferred to an appropriate adolescent bed somewhere else in the state. I guess then it's on to you.
So once we have individuals that are accepted and admitted to our unit, they have a care team that follows them. So the care team is one of our psychiatric practitioners, either the psychiatrist, psychiatric nurse practitioner. They have a nurse that's assigned to them every day They have a rec therapist, and then we have a social worker, a nurse case manager, and a substance use counselor. Primarily, the discharge planning is done by myself and our nurse case manager. So typically, I guess I'll talk mostly about my role, is to help the patients plan for discharge. So that's something that I really do right away. Reason being, it can be really difficult to find services for individuals and the wait times are long. So that's something that I like to start with right away. A lot of times we have patients already come to us with established providers. So we check in with them, make sure, hey, do you want to follow up with them? Would you like to try services somewhere else? Largely my role also is I complete assessments. There's a few assessments that I do with patients. Really serve as a liaison between the patient's family and the physician, the nurses. I really kind of call myself the jack of all trades, because I can't think of much that the social work staff doesn't do or doesn't help with. When it comes to that, average length of stay, typically, we would tell people is 3 to 5 days. That really varies on the patient and what their needs are. Some people don't stay that long. Some people stay much longer. That is assessed daily by either the psychiatrist or the psychiatric nurse practitioner to assess where that person's at with their mental health. Are they getting close to being ready for discharge? Do we need to make medication adjustments? All of those things are assessed on a daily basis. And then we have a treatment team meeting, myself, the lead nurse, psychiatry staff, to discuss patient care and sort of touch base and make sure that we're all on the same page when it comes to discharge planning for our patients.
So in this situation as advocate, I would not be involved because the individual was willing to go to the hospital voluntarily. So as advocate, I'm appointed if there is a commitment. And so that kind of scenario, if someone goes and they're willing to go, willing to receive the treatment, there's not going to be a need for the court to get involved. And then there's not going to be an advocate that's appointed. There are times, for instance, in this scenario where someone does get to the hospital and then they change their mind and the doctor feels like they're not safe to discharge. At that point, we sometimes see where hospital staff will file. It requires, I don't want to go into too many of those details, but it requires 2 people that need to file.